Thanks so much, Rhonda. And before we officially commence, I wish to acknowledge the traditional owners of all the lands and waters throughout Australia on which our work takes place. In particular, I would like to acknowledge the Turrbal and Yagara people of the Yagara Nations, whose country the AgPower Group head office, including the Care Opinion office, is based and founded in Brisbane. We pay our respects to their elders, past, present, and emerging. And I would like to acknowledge and warmly welcome any Aboriginal or Torres Strait Islander peoples joining us as we connect today. And a very, very warm welcome to you all from across the nation, from across the globe. Thank you for attending our first Care Opinion Australia's online forum since 2021. We're very excited to be here with you today and to commence this journey and to ensure that we continue to engage with you on a more regular basis from here onwards. Before we commence our full program, I would like to start by providing a brief history of Care Opinion for those who may not be as aware as how we've come to be where we are. Our connections with our International Association for Public Participation Framework for Engagement and the alignment and directions with current and emerging national and state policy and Australian healthcare reform. Care Opinion commenced in 2012, and back then it was called Patient Opinion for those who have been engaged in this process since then. It has its roots back in Care Opinion UK, and we are so very fortunate to have our long-standing colleagues from the UK and Scotland supporting us in the past 10 years as we embarked on our Australian Care Opinion journey. And Care Opinion Australia's philosophy has grown with the national reforms that we see here today and in the past few years, encompassing experiences beyond health to aged care, community services, and we are an enabler to every national and state policy and framework linked to consumer voice, including the Western Australia Sustainable Health Review recommendations, the Safer Care Victoria's Partnering with Consumers framework, the Elevating the Human Experience in New South Wales, just to name a few. Everything that we do, everything that we aspire to do is connected with the policy levers, with the reforms, with the strategic plans that are across our nation. We believe that we are at the empowering end of the spectrum for public participation, working in the neutral space alongside the consumers and the health service to generate the genuine co-design and improvement that's required in our communities. And we are proud to respond and take up the World Health Organization's call to action to elevate the voice of the patient in safety, and the WHO's call for platforms that enable families, patients, carers to engage with safety as they experience their care. And today, we're very fortunate to take you on a journey that the World Health Organization is aspiring us for. We will engage with international and national leaders in health, quality and safety who are working with the power of patient narratives to not only inform quality and safety practices, but encourage staff on their continuous professional improvement journey. And in a lot of ways to bring joy to work through this engagement. And we see this at the first of many engagements that we will support stronger uptake and application of the patient stories bravely shared by the citizens wanting to improve care and have a safer system for all our communities. So this is one of many forums that we hope to host, so we are able to constantly bring a network of the willing together change agents, champions who are able to support each other to elevate the consumer engagement and voice. And thank you for your support and for helping us to continue to build a network of like-minded individuals organisations, a coalition of kindred spirits who are working so hard, both at the grassroots and at policy levels as well, to ensure that the consumer voice is at the forefront of everything that we do. So I'm really excited now to kick off our first session, and we will try our very best to keep to time and not go over the allocated time for each session. So in advance, I thank the presenters for keeping to time, and we'll try and do that throughout the entire session. The first session is Care in Precarious Times. How will the consumer voice take us towards zero patient harm and international perspective? So 3 years on from the pandemic, the feelings of uncertainty and frustration are still very raw and very real, both for the consumers navigating complex care systems and the workforce who are there to support this. And the evidence is clear that the way towards a zero harm system is to co-design with patients, which means being open to feedback and doing things differently. And how is the health care sector responding to the consumer voice, or are we still reacting to feedback? In this session, we will be hearing from our international colleagues from Care Opinion UK and Scotland as they share with us how relational feedback is making a difference to the safety of culture of care in the UK and bringing staff along the journey. As many of you may be aware, Care Opinion UK has been going for over 18 years, and it's really seeing how the feedback data is supporting safer care and happier teams. And I have the pleasure of introducing, as our first presenter today, the co-founder of Care Opinion and CEO for Care Opinion UK, Dr. James Munro. James has been at the helm of Care Opinion UK since 2014 and has a background in clinical medicine, public health, and health services research. James has spent much of the last 10 years overseeing the development of the Care Opinion platform, building the community of practice for relational feedback. And James will take us through the evidence and motivations for why people post feedback online and how this relates and to impact of staff, their morale, their confidence, pride, and the flow-on benefits for a culture of openness, learning, and improvement. A very warm welcome to you, James.
Thanks very much, Tina. Lovely to be with you this afternoon. Great to be connecting from a rather damp and cold UK. I hope it's nicer where you are. So let me share my slides. I've got a few slides to run through. We'll see how the time goes, but if you've got questions as we go along, if you'd like to pop them in the chat, that's fine. If I sort of spot a question I can answer as we're going, I will do. But I know we also have time for questions after Fraser's session, so feel free to pop any thoughts or comments or questions in the chat. And as Tina said, I'm going to talk a little bit about care opinion and culture, and indeed the notion of solidarity between patients, carers, and staff. So I'll talk a little bit about that. We'll touch on a few research findings, but there's a session a bit later on in the program where I'm going to come back again and talk a bit more about research as a specific topic. But we'll mention a few researchy things as we go along now today. So we're talking about how people's feedback online in near real time can help healthcare get better. Can it help improve the quality and safety of care? That's what we're interested in this afternoon. And you may be an old hand with Care Opinion, so you may be very familiar with it. On the other hand, you might be quite new to seeing Care Opinion, seeing how it is. So just as a quick background, I'll let you know where we're up to in the UK. So this is our
Sorry,
mission
James.
statement.
Sorry to interrupt. We can see your second screen. So I just wanted to check in with you there that you knew that was appearing.
You're seeing the wrong screen, are you? Oh, you are.
We can see both.
Hopeless. Okay, let me do this again.
Thank you.
We need this one. Let's try this. Is that better?
Perfection. Thank you.
Yes, okay. You can tell it's early in the morning. I haven't had enough coffee, have I? So here we are with the care opinion vision statement. We want people to be able to share their experiences of health and care in ways which are safe and simple and lead to learning and change. That's what we're interested in. We know these words in pink sound straightforward, but of course we know they're complex. People often don't share their experiences with healthcare staff because they're scared to, or they think it's pointless. Systems for giving feedback, for raising concerns, and indeed systems for giving positive feedback are often complex or non-existent. There are typically in most health systems, perhaps all health systems, there are no formalized methods for giving positive feedback, for expressions of gratitude, for example. They're not recorded. We rely on thank you cards and boxes of chocolates. So we don't get the most out of the gratitude that people want to share. And indeed, we know that in most health systems, certainly in the UK, we collect a vast amount of feedback data, but we don't use it for learning and change. So we may know a lot about, we may collect a lot of data on experiences, but is that leading to a safer, higher quality health system? So these are the interesting and important challenges that face all health systems, I think. And on care opinion, this is a recent screenshot. We're actually up to just over 600,000 stories on care opinion in the UK now, and around about 14,000 staff listening and responding to those stories. Response rates vary around the UK, but in Scotland and Northern Ireland, where care opinion is embedded at system level, response rates are around 96 or 97%. That's how it is. So people come along and they share their stories, and let's just look at a typical story and then think about why this has been shared and what the impact might be. So this story is called "We're So Grateful for the Effort, Time and Love That's Given to Our Family." And this is a story about somebody's child, somebody posting as a carer or a parent of a child who's saying, "Our son has pushed every single limit possible when it comes to his health over the last 4 years to a different level. In and out of surgery, medical devices in his abdomen. It's safe to say my son takes a lot of care and medical intervention. My son's very complex. And we're so grateful for the effort, time, and love that's given to our family, especially my son's sister, because it's not always easy having people in your house and you're getting ready for school. The CCN aren't just my son's nurses, they are our support network and the backbone, why we're able to live a life full of fun amongst the madness at home." So here's somebody giving some lovely positive feedback to a health service team. And here's the response from the lead nurse in that service. She says, "Thank you for your amazing feedback about the team. As lead nurse for the service, it really made me smile. As soon as I read your story, I phoned the team. It's created a real buzz in the team, which has rippled out across our service." And then she goes on to describe the various members of the team that have contributed, and she names them and talks about the impact of the care. So let's just pause for a second and think, well, why has this person shared this feedback and what impact has that had? And you can see even just from this single story that this is an expression of gratitude, a wish to acknowledge the difference that this team has made, a wish to encourage them, to let them know how important they are. And you can see that that has worked. Here's the member of staff responding and saying that she's shared it across the whole team. It's created a buzz, a ripple across the service. And this is an act of gratitude and an expression of solidarity with staff, which has, in this case, been shared widely for positive benefit. And we'll come on to some of the evidence around this. So let's broaden out a little bit and look at some of the research evidence on this question. Why do people post their feedback online in the first place? What are they trying to achieve? And when they do post feedback, are they successful in achieving their goals? So we have some evidence in this space from the research that's been published. This is an early paper which is a cross-sectional study of 1,000 adults in the UK. And this paper found that in the past year, about 42% of the population, the adult population of the UK, had read, and about 8% had shared online feedback about healthcare. not just on Care Opinion, of course, through social media, blogs, and so on. But it's quite a percentage, and this is 5 years ago now. So I suspect this has probably gone up a bit. So we might imagine that perhaps half of people have read feedback about healthcare relevant to them online. This paper also went on to explore the question about why people share their feedback. And you can see the top 3 reasons here are to inform other patients, to praise the service, and to improve standards of care. So that's what people are trying to do typically. These are positive pro-social motivations to help staff to improve care for other people, to let other people know what the care is like. These inform, praise, improve motivations. We've found this in further surveys that we've done ourselves. For example, among patients in Northern Ireland, we've confirmed the exact same finding. The negative motivations are much lower. And interestingly, as part of this same research, the research team surveyed staff to find out how they feel about online feedback. And there's an overwhelming perception among clinical staff that most online feedback is negative. But in actual fact, that's not the case. Certainly in the UK, we find 70 to 80% of online feedback now is completely positive. So clinical perceptions of online feedback, particularly among doctors, are much more critical than is the case. So it may be, I think a lot of clinical staff's experience of online feedback is through unmoderated social media like Facebook. But if you come to a dedicated feedback platform like Care Opinion, their perceptions are completely wrong, and it's mainly positive feedback. And we need to think about why that matters. So this is a paper that I would recommend to everybody to read. I think this is one of the best papers that's been written so far about online feedback. This is from Fadila Mazandarani and other academics from Oxford University in the UK as part of the same nationally funded research that the previous paper came from. And this paper is called Caring for Care, and it's a paper which is based on interviews with around 40 people who've shared feedback online, talking to them about their motivations and why they were doing that. And here are some of the illustrative quotes from that work, which I think are very instructive for our purposes. So the first one here, somebody says, I wanted to say thank you to the GP who'd been really, really good with me. And the way I did that was by emailing the practice manager and just saying, I've had this good experience, thank you. Because I was hoping, I guess, they could use that somehow with the regulator or something. So people are assuming that the feedback gets used, that it makes a difference, that it can be used by health service teams. Somebody says, I realize that, the NHS is under such huge demands, everything else, but unless we tell them what's wrong, they can't put things right. So again, this notion of people as critical friends wanting to support improvement in healthcare. And then somebody very explicitly saying, I firmly believe that in a subtle and perhaps longer term way, I'm contributing to change. So the picture we're getting here is of people posting their feedback, not simply to provide data, not simply to complain, not simply, as many health service staff believe, to sound off or to rant, but because they're trying to help, they're trying to change, they're trying to improve the service for everybody. So these are acts of solidarity and altruism and connection with health services and other health service users. But how does it feel from a staff perspective? So if that's what patients are trying to achieve, are they achieving it? And we have a little bit of evidence on this. We don't really have enough evidence yet in this area, but we have some early evidence. And this evidence this particular paper comes from the southwest of the UK, from a hospital that introduced Care Opinion. And this is an interview study with staff after the first year of implementation. And it's called Implementing Online Feedback in a Special Measures Acute Hospital. The hospital was struggling at the time and was under special measures with the regulator. And again, this paper showed that the feedback coming through Care Opinion has a significant and positive impact on staff. So there was a very positive picture painted. And as I recall, there were about 28 different impacts that the research noted. But this is one of the quotes in the paper that jumped out at me, and it's related to morale. So this is a clinical manager in an emergency department in the hospital. She says, I really love it. Working in the emergency department, you see a lot of terrible things happen. You see a lot of sick patients. So for me, it's such a refreshing change because we predominantly get positive feedback. It's just so nice to be able to cling on to that. I think it helps improve morale. It helps people's resilience as well to know there are actually some really grateful people out there. So this perception from staff who are receiving online feedback through Care Opinion is that actually it is making a difference for them. And there are other interesting quotes within this research around issues of staff pride in the service and confidence, people saying that they learned from using Care Opinion how better to talk to patients, how to deal with conflictual situations, and so on. So I found that a really positive and helpful paper. So let's have a look at a slightly less structured and slightly less rigorous data, which is Twitter. So a few things from tweets from that we've captured over the years, staff reacting to stories on Care Opinion. This is a nice one from a hospital in North London. Raki says, the team are loving the feedback and the ability to respond directly to service users. It's got us all hooked. And then here's a message from Lindy, who is a nurse in Scotland. She says, when I read this, I remember why I became a nurse. Thank you for appreciating us and what we do. And this is, I think, this really illustrates how stories from patients can reconnect people with the values that took them into healthcare in the first place, reconnect them with their personal sense of mission and purpose in their roles. And I think that's a powerful thing for people. And here's another nurse in Scotland, Karen, saying, this brought me and many of the other team members in Ward 12 to tears. Great to know we've had such a positive impact on this family, but also important to note the positive impact their words have had on the team. So Karen here in this tweet, drawing attention to this notion of a virtuous circle, if you like, of good care leading to positive feedback and gratitude, and that flow of gratitude coming back into the team and having a positive impact then on the team, who can then go on to provide further good care. So this is the kind of virtuous feedback circle, if you like, that we're wanting to create and apparently are creating very often with Care Opinion. And that's what we're seeing. So there's a whole range of different things that people can learn from the feedback that people share. It's not just about, food and parking, is it? There's plenty of richness in the stories that people share, and they're used very widely in education settings now in the UK. Many universities using Care Opinion in their curriculum. But these are some of the topics that you can learn about from reading and analysing stories. Patient experience and person-centred care, of course, we expect to be learning about that, but communication, empathy and compassion, ethical issues, quality improvement, leadership, how to respond to complaints, interprofessional learning, because you see the contribution of all team members, you see the importance of teamwork, good teamwork, and understanding what others are contributing to care, and digital professionalism too, which is an important issue for new healthcare staff, very often learning what can and can't be said online and how to remain professional in online settings. So these are some of the topics. There are many others, of course. And here's a quote that I like from Alex Clements. Alex is somebody who's been helping with the rollout of Care Opinion in a health service trust in the south of England. They've been using Care Opinion for about a year, and he presented at our spring conference this year, and he said Care Opinion has changed culture in a way which is soft, organic, and relaxed, not corporate. And I really like that idea that actually it's a kind of culture change that creeps up on people, that we don't tell them how culture is going to change. We don't tell them how they have to behave or be different or think differently. The stories, the supply of gratitude, of insight, of authentic voice, whether positive or negative, leads people towards culture change. And just on that note, let me quickly mention a blog that came out yesterday from one of our subscribers, actually at the same trust. Let me just see if I can flip to this without breaking anything. This blog came out yesterday, and I'll post a link to this in the chat because it's particularly interesting, from Abby Barkham, talking about how patient narratives enhance understanding within healthcare teams. So I think you might enjoy that, and I'll pop that into the chat in a moment. So let's go back to the slides. Hopefully I haven't broken them. And just for my last slide, I'll mention a book that came out recently, again from an academic in Scotland, actually, from Ellen Stewart at the University of Strathclyde. She wrote a book about the complex relationship the citizens in the UK have with their health service, with the NHS. And as part of that, she included a chapter analysing stories from care opinion, looking at how people give feedback and what that tells us about their relationship with health services. And in that, she says, the analysis of patient narratives suggests a struggle between the desire on the one hand to protect and support the NHS, and on the other to share difficult, at times traumatic experiences of care in order to hopefully to improve care and bring about positive change. And she goes on, these are actively sought out opportunities to offer feedback as a gift to the NHS, and as such are not merely cultural but also political acts. So I think this sort of pins it down, really, that people are trying to make interventions, and we can come back to this question later when we talk about some of the research. People are not just sharing data, they're not just giving their feedback and then forgetting all about it. What they're doing on care opinion is very often giving feedback to create change, to make an intervention, to encourage staff, to help improve the quality and safety of care. So I'll stop there, and hopefully that's been helpful. And if there's any questions or time for questions at this point, we can pick a few up, or we can do that after Fraser's talk.
Happy to take some questions now, James, if anyone has anything that they'd like to pop into the chat there. Thank you very much for a great overview. There's always so much happening. See anything in the chat?
I'll put the
there?
link to that blog I mentioned into the chat as well, just so that people have it in case you want to have a look at that afterwards.
Sorry, I've got something.
Claire's got a hand up.
Great. Thanks, Claire.
Thank you, James. I wondered, I've really been excited to watch how care opinion has really been embraced by different bits of the NHS, including, for example, medical education. I wonder if you got any anything that you can say about how, so here in Western Australia, certainly, many of our health services have what are called consumer advisory councils, or committees of patients or service users who are part of the governance structure and provide advice and work in partnership with the health service providers. And I wondered if there's anything similar in the UK, and how, if you know of anything of how care opinion is being used by that group as a, if you like, as an extra lever for that partnership as partners of improvement.
Yeah, great question. And the answer is a little bit unclear, really. I mean, we do have very similar bodies in the different health systems of the UK. So, for example, in England, we have something called Local Health Watch. They're typically at local authority or council area across England. In Scotland, there used to be health councils. Fraser can bring me up to date on what they have now, I'm not quite sure. And in Northern Ireland, for example, there's something called the Patient and Client Council. So there are different, if you like, consumer kind of advisory and input bodies in different parts of the UK. Their relationship with care opinion has been slightly uncertain, I think, over the years. So, for example, in England, which is the bit I probably know the most, some health watchers have, as you suggest, have sort of embraced care opinion quite enthusiastically and used it to seek feedback and to collect feedback and to create reports and so on, and fed them into the local health system. Others have, in a sense, felt that we've been treading on their toes, that actually it's their job to do this kind of feedback and collect stories and so on, and that we're some sort of interloper getting in the way and sort of getting into their territory, really. So some have been a little bit more antagonistic. More broadly, I mean, the national patient groups and national patient charities, it's been a similar thing. Some have enthusiastically embraced care opinion and used it in all kinds of ways for local and national campaigning and pushing for certain policy changes. And others have sort of tried sometimes, or thought, can we fit this in, and then haven't really found a way to fit it into the things that they're interested in. So it hasn't been a sort of uniformly successful relationship. It's been quite uneven in different places, and I think it depends a little bit on people's attitudes to working with others in the sector, really.
Great, thank you.
Thanks, James. Let's see if we got any. I've got another couple of questions in the chat here. There's a question here from Aurora wondering if there are ways to moderate stories shared on the Care Opinion platform, or we can talk about that, particularly for complex feedback requiring more investigation or staff management or nuance. Perhaps we can keep that one. We can have a little bit of a chat about that at the end, perhaps. How do we expose staff to include all, including sometimes severely negative feedback, in a responsible way? Did you want to comment to that, James? We're talking about some pretty serious feedback there.
Yeah, that's right. So all feedback coming through Care Opinion is moderated. It's moderated by humans, not by machines. So that's done very carefully. Sometimes it raises important legal or safeguarding issues. We have to address those issues of defamation and so on. We do it in a way that means that we try to minimise harm for everybody concerned. So to keep patients and carers safe, to keep staff safe, everybody needs to be kept safe, so that, like anything in healthcare, like any intervention, we want to maximise the benefits and minimise the risks, don't we? So it's exactly the same with healthcare as it would be with a new drug, that we have to focus on how do we get the benefits, but without causing any bad side effects for people. And that's really important. We spend a lot of time thinking about that.
Thanks, James. We've got a question there from Karen, which I can follow up with afterwards, Karen, in regards to your question. In terms of what we're doing, that's why we're all here today. The Care Opinion Australia platform is the little brother or sister or sibling of Care Opinion UK. We're a bit younger. We've only been going for 12 years, but we look up to our big sib to give us the straight dupe on how to get it done. So we work in partnership closely. So we can follow up with you afterwards there, Karen, in terms of what we do in Australia. And we'll hear some more from our colleagues in just a little while. Lovely comment there. Southeast Sydney been using it since 2015-16. We love that. They're one of our longest serving subscribers, and we'll be hearing from some of your colleagues this afternoon. James, if you were starting again, what would be your key piece of advice for someone starting on the journey?
Well, that's a slightly ambiguous question. If I was starting again running Care Opinion, or if somebody was starting again using Care Opinion, that would be a slightly different thing. I think if I was starting again with Care Opinion, I mean, there are various things that we've designed that I think we've probably got slightly wrong and that we're trying to fix as we go along. I probably want a lot much more funding behind me before I started. But we have, of course, on all journeys, you learn an enormous amount as you go. And so you are constantly making improvements. In terms of people starting to use Care Opinion, I would say dip a toe in the water, try it out. Don't expect to go too far too fast. It's a very incremental and learning process for everybody, I think. This is a new way to do feedback that's unfamiliar to people, a bit scary. Many clinical staff start off being very scared of the idea of open online feedback. You don't have to do it as a big bang all at once. Build it up slowly. Start with your enthusiasts, early adopters, and spread out from there. And you'll learn as you go. And that's the approach we're taking in the UK, and it's working really well.
Right. Thanks, James. Thank you all for putting your comments and questions in here. I think we've got one more here from Tanya, just a last comment. I think it would be a great addition to disability services. Would love to be something just the NDIS providers had to sign up to. Tanya, we absolutely agree. We've been trying to engage in that space, and I expect that we'll see some inroads there soon.
Wonderful. Thanks very much, Alicia, facilitating some of those questions. We got a couple in, and we'll have time, hopefully, at the end of the session for some more questions. Thanks so much again, James, for sharing your experience, the research findings, the thought-provoking insights from years of experience. We really appreciate your accompaniment and the support of the Australian journey. As always, you're very generous, and we very much value this relationship and learning from you. Now we will move on to our next presentation. So branching out and putting down roots, embedding practice across health and care in Scotland. Presentation by Fraser Gilmore, Executive Director and Head of Care Opinion Scotland since 2020. Fraser leads the organisation's work with the Scottish Government, all of the territorial and special health boards and the Health and Social Care Partnership, as well as education and research in Scotland. And prior to coming to Care Opinion UK, Fraser worked in senior roles in the voluntary and statutory sectors for over 15 years, working with homeless people, disabled people, older people, members of the armed forces community all over Scotland. And throughout his career, Fraser has been passionate about empowering people's voices to affect positive change on the things that impact on their lives. Today, Fraser will share with us the experience of greater use of the Care Opinion platform, including members of the public, and importantly, for partnership staff and NHS boards. Welcome, Fraser. Take it away.
Thanks very much, Tina. Let me just try and share my presentation. Let's hope this works. Right, hopefully you can see that okay. So as Tina says, my name is Fraser Gilmore and I'm one of the executive directors at Care Opinion and the head of Scotland. So in today's presentation, which I've titled Branching Out and Putting Down Roots, Embedding Practice Across Health and Social Care in Scotland, I'm going to be sharing our journey in Scotland as one of only 2 nations who've taken a system-wide approach to using Care Opinion. I plan on taking you briefly through how health and care work in Scotland, how we've supported the various health and care services across the nation to embed our model of feedback into their practice, what we're learning from this engagement, and hopefully exploring what the next step on the journey is. So firstly, I thought I'd tell you a little bit about our team in Scotland and more widely in the UK. In our Stirling office, we've got a team of 7 who support all of our healthcare organisations in Scotland. However, this is part of a larger team, the rest of whom are based with James in our Sheffield office, who support our English, Northern Irish and international work. Overall, we're a team of around 22 people. We describe it as 2 locations, but 1 team, as we all work very closely together, and lots of our work and support streams intertwine. I tell you this because a lot of people have this concept or idea that we're a massive corporation, but no, we are a small band of people who run a social enterprise and believe that people's voice and experience can be transformational to healthcare. So secondly, I thought it important to put some of this in context. Scotland is a country of about 5.5 million people. We've got 8 cities, more than 50 towns, around 7,000 villages, and around 70% of the population lives in the thinnest part of the country, around and between Glasgow and Edinburgh. So the problem for healthcare is that we have some very urban areas and some incredibly rural areas. To give you an idea, the Shetland Isles in Scotland are closer to Norway than they are to Edinburgh. Health and care in Scotland is provided by 14 territorial health boards who deal with acute care, 31 health and social care partnerships who deal with a variety of secondary community health, as well as social work, social care, care homes, day services, and other forms of social community services. And the health and social care partnerships also commission a variety of third sector, not-for-profit and independent sector organisations who provide some of the care services as well. We also have special health boards who provide services like healthcare over the phone and online, the ambulance service and the air ambulance service. So that's healthcare briefly in Scotland in a nutshell. And as I noted earlier, Scotland is one of only 2 nations who take a system-wide approach to care opinion. And this is enabled by the national subscription provided to all of the territorial and special health boards by the Scottish Government, who also use care opinion stories in their various health directorates and departments. So as well as all of the service providing health boards in Scotland encouraging and responding to feedback, we also have NHS Education Scotland, Healthcare Improvement Scotland, and National Services Scotland utilising care opinion too. Unlike the health boards, the health and social care partnerships are responsible for their own subscriptions to care opinion, and we currently work with 12 of the 31, and this number is growing all the time. In Scotland, we've also built up relationships with many local and national third sector organisations utilising care opinion in a variety of ways. And regulators, as well as the ones mentioned in health, like the Care Commission, also utilise care opinion. But these organisations don't represent everyone using care opinion in Scotland, and the why and the how does vary massively. So for staff and services, they use care opinion as an opportunity to read and respond to feedback from the public, to take on board this feedback, learn and change from it as a result. For civil servants and policymakers, they use it to help benchmark, inform policy and strategy, service design and future policy at local and national levels. We have lots of politicians in Scotland listed on care opinion, or members of the Scottish Parliament, and they use care opinion to keep informed about what their local constituents are saying about their local and national services. For researchers and educators, they use it as a teaching tool for future and current health and care staff, and to conduct research on the care opinion model and what people are saying about services. For third and independent sector organisations, they use it also as an opportunity to read and respond to feedback from the public as service providers, but also to use the voice of the public to inform their areas of work. And lastly, but most importantly, the public, who share their stories about their healthcare experiences because they want to give credit where it's due and make suggestions for improvement, as well as to read and learn from the experience of other members of the public. So, although care opinion's been around in the UK since 2005, the journey in Scotland started in 2011, where the care opinion model was tested with a variety of health boards with seed funding from the Scottish Government. More funding was allocated in 2013, with full funding being granted in 2014. Since then, we've been granted funding from the Scottish Government to provide our service to all of the territorial health boards. As often happens in government, legislative changes happen, and in 2014 there was a seismic change with the introduction of the Public Bodies Joint Working Scotland Act in 2014. This legislation was created to integrate health and social care in order to improve outcomes for patients, service users, carers and their families. And the Act required that health boards and local authorities work together effectively to agree a model of integration to deliver quality, sustainable care services. They did this by creating the 31 health and social care partnerships across the country, which meant a new way for us to be approaching our work as services were being delivered in a slightly different way. But with this new approach came new opportunities. The integration agenda meant that there was a real focus on the full health and care pathway for patients and service users through services, and care opinion was able to adapt to enable the public to share their experiences in this way. So from then until now, we've supported around 39,000 members of the public to share their stories on care opinion about services provided by health boards, health and social care partnerships, and third and independent sector organisations. And with this increased work across the nation, this number is increasing rapidly. And to give you an idea of this, in 21 and 22, 4,696 members of the public shared their stories about just health boards. In 22 and 23, it was 6,455. And this financial year already, more than 5,000 people have shared their stories, with 5 months still left to go of the financial year. So you can see why for our 22-23 annual review of stories about NHS Scotland services and for this presentation, our theme was branching out and putting that down roots, which reflects the story of care opinion in Scotland currently. In 22-23, we reached the milestone of 30,000 stories shared by members of the public on care opinion. And to help us celebrate this, National Clinical Director Jason Leach, who's also a friend of Care Opinion Australia, left us this quote, which was, "The experience of patients, families and carers is crucial to the staff of the health and care service. Care Opinion has unlocked these experiences and brought them to light to allow celebration and improvement. It's been the most important person-centered change of the last few years." On the slide, you can also see some stats from 22 and 23, which starts to paint a picture of how Care Opinion is being used in Scotland. 6,455 stories shared shows the increased number of stories shared by the public. This increase comes from the increased engagement from the boards, how they're increasing their communication around feedback, how they're thinking about patients and how they want to be communicated with, how and when they're asking for feedback, but importantly, the fear of feedback is dissipating as many people become used to it and it starts to become part of their daily practice. Sometimes the fear of feedback comes from the idea that the majority of feedback received will be negative. And as you can see during this year, on average, 73% of the feedback was completely positive, with the remainder having some level of criticality. This number, as all of them are, is an average, as there are differences in region, location, and clinical function. What this number does tell you, and as we know from experience, the better services promote storytelling on Care Opinion, the wider the audience. And the wider the audience, the more likely you are to capture a wider variety of views, even those people who would not usually give feedback. It also gives services the opportunity to celebrate what they've done well and reinforce practices, while learning from what has not gone well for people and using that feedback to develop and change. The number of staff listening to and responding to stories in Scotland is also increasing all of the time. In 22-23, there were 3,460 members of staff listening to and responding to stories across the country from health boards. And it looks like this number might hit 4,000 by the end of 23-24. This increase and depth is also a reflection in services being listed on the platform. We're not just seeing clinical functions, but sub-services who are keen to get feedback specifically for this area of practice. And to give you an example that we really like from this year, we recently listed medical tattooing, which was part of the breast cancer service, where previously breast cancer was a standalone service. This means that more staff are listening to and respond to stories, and responses more and more are coming from as close to the care as possible, where it can make the most difference. We've also seen increases in responses. As you can see, the story shared received a much higher number of responses than the stories themselves. And this shows multiple responses to stories. And in Scotland, we find this really exciting. Every author on Care Opinion has the ability to share any part of their healthcare journey. This can be to talk about one particular member of staff, all the way to calling an ambulance, being taken to A&E, being admitted to a ward, being discharged home, and receiving care in the community. In this latter case, all services can be tagged and all can respond to their particular part of the story. And the NHS and other services are able to hear from the person about their full care pathway experience. As part of this, the response rate in Scotland is very high as compared to other parts of the UK. And I do think this has a lot to do with the national buy-in to this model and the number of staff and teams that have access to Care Opinion and have responsibility for it. This is also reflective of the buy-in from staff, civil servants, policymakers, researchers, educators, the third sector, and of course, members of the public, with the increasing readership of Care Opinion stories. And as you can see from 22-23, almost 1 million reads of these stories. In 22 and 23, we asked some of the boards we work with for their reflections on the year in terms of their use and engagement with Care Opinion. And I wanted to share one of these reflections with you. This came from Nicole McAnally, who is the project manager of the Patient Experience and Public Involvement team at NHS Greater Glasgow and Clyde, which is the biggest health board in the country. Listening to our patients, their families and carers, and hearing about their experience of care is extremely important to NHS Greater Glasgow and Clyde. Care Opinion provides us with the opportunity to gather real-time feedback and open a two-way dialogue. Person-centred care can only be delivered by listening to patients and carers and finding out what matters to them. The feedback we receive helps us to capture what matters to our patients and their families, identify themes for improvement, as well as celebrating what works well, providing the opportunity to acknowledge the great care provided by our staff. We continue to raise awareness of care opinion among our staff, patients, carers, and their families, as one of the main mechanisms for people to share their experiences about the care that is received and how we deliver our services. We increasingly use social media to raise the profile of care opinion, sharing people's stories during a number of awareness days, such as International Nurses Day, Midwives Day, and Carers Week, alongside more regular promotion with our hashtag Feedback Friday and our hashtag Tell Us Tuesday campaigns. On a weekly basis, we include positive feedback via our Chief Exec's brief and also include regular articles in our staff newsletter. We've also developed a new care opinion webpage for staff. Going forward, we plan to develop our approach to demonstrating how we learn from the feedback we receive and the improvements flowing from this. This includes empowering and encouraging staff to act upon feedback, to influence change in practice, record the actions taken as a result of the feedback, and close the loop on care opinion, thus demonstrating to those sharing their experiences and the wider public how feedback has really made a difference. So in these two quotes on screen, they're reflective of the messaging we hear from health and care services all over Scotland, as they further embed care opinion into their everyday practice. And as you can imagine, because of the diverse geography, demographics, population density, and different stage every healthcare organisation in Scotland is on in terms of their feedback journey, there are differences in practice and levels of engagement. However, there are some powerful themes that health and care organisations across Scotland report in terms of their use of care opinion. They report increases in staff morale, and this empowers staff to seek more feedback about their practice and service. It supports staff, teams, and services to really think about and reinforce practice that the public reports as positive. As staff and services' inclination to defensiveness reduces, they are more open to consider service improvement and change based on the feedback they're receiving. This move towards openness and transparency has a positive impact on staff, team, and service culture, which benefits staff, patients, and carers alike. We've started to see health and care organisations consider more how they listen, act upon, report, and share feedback and the changes that come from this at every level of organisations. From social media campaigns to corporate reporting, from feedback boards and wards to stories being used to influence practice, policy, and strategy at ward, sector, hospital, and board levels. We're seeing how all of these organisations are considering how feedback on care opinion is integrated with other forms of feedback and complaints processes. And in many cases, care opinion is being used and encouraged as their main avenue for feedback. But importantly, across the nation, we're seeing an appetite and a want to do more. As care opinion in Scotland is supported by the Scottish Government, this also means that care opinion can and is being used, not just as an information source, but as an intervention into systems, processes, policy, and strategy at a national level. Some recent work that we've been involved with the national teams has included working with the National Cancer Policy Team. We helped them see what the public shared about cancer services, help them to continue to track what people were saying, help them consider how to increase story numbers from people using cancer services. And these stories were used as a part of a larger programme in the creation of the Cancer Strategy for Scotland 23 to 33. Working with the National Realistic Medicine team, we're helping them understand what patients are saying in terms of shared decision-making, personalised approaches to care, reducing harm and waste, reducing unwarranted variation, managing risk better, and innovation. Using our API access keys, Healthcare Improvement Scotland have created their own national dashboard of the stories coming into care opinion, so they can analyse what patients are saying using their own metrics. With a value-based health and care team, we recently supported the creation of a national e-learning tool for health and social care staff around outcomes and experiences that matter to people. These are just some recent examples, but interesting stories the public are sharing on care opinion at a national policy and strategy level continues to grow. And at the start of this month, we were also delighted to co-host our very first Policy and Strategy Summit, called What is the Value of Online Feedback to Healthcare Policy and Strategy, which was done in conjunction with the Public Health Agency in Northern Ireland and the Scottish Government. This started a really valuable conversation between two areas taking a system-wide approach to online feedback. And it was, I hope, the first of many conversations and collaborations to come. And I'm just going to touch on research and education for my final part here, as I know that James will be talking about this later, but I feel it's important to mention it as part of Scotland's journey, as the intersection between service delivery, policy and strategy, education and research is an important one. We've had some great research come from Scottish academics on the care opinion model and using care opinion stories. As James already mentioned, Fadila Manzandurani, her paper Caring for Care from the University of Edinburgh, to Ellen Stewart's book Why Britain Loves the NHS from the University of Strathclyde, to Emma Berry's Using Humanity to Change Systems from the University of Aberdeen, who we're very happy to say has just completed her PhD that talks about care opinion and the NHS in Scotland. There has been more, and I hope there will be more in the future, because research and the academics lens adds another layer to our understanding of why people post feedback online and how this feedback can be used to improve services. And in terms of education, I've already talked about the work with value-based health and care, but we also support aspiring medics of St Andrews University with placements at Care Opinion, and we are currently working with students of the University of Stirling. Again, this is another area of work we look to increase our presence in, as we know it's important to embed an open and transparent and person-centred approach to health and care staff, whether they're still in training or they're already working. So where next? Although in terms of a system-wide approach, care opinion in Scotland is the most mature in terms of its progress, there is still much more that can be achieved. We're seeing great depth in services and number of stories that's increasing all the time, but we will work with services to continue that journey. We'll continue to work with the Scottish Government and partners to explore the policy and strategy implications of online feedback and how we can further embed this into practice. We'll continue our support of cross-system learning between countries of the UK and further afield, further support research and education opportunities, but importantly, we will continue to provide a safe place where people can provide their feedback so healthcare services can develop, learn and change as a result. Thank you.
Thank you very much, Fraser. That was fantastic. I think we have a couple of questions sorry, we've got a few questions here in the chat for you. Let me just pull that up for you. Hang on one second. So Tanya was asking, and I know you spoke about some of your strategies that you've been using with social media and campaigns and others. I know Sarah and my eyes lit up when we heard Tell Us Tuesday. I absolutely love that, and we'll be looking to beg and borrow that. But how do services in Scotland encourage the use of care opinion?
Oh, that's a very big question. So there's a lot of different ways, and we try and support people to really think about their patients, families, and carers, and what their needs are. As we recognise, the age group is really varied, and people's access to the internet, for example, is very varied. So we get them to think about who their users are and how they want to communicate with them. So in Scotland, we have lots of poster campaigns. We have campaigns where people are giving out postcards. They're giving out credit cards. We have screens up in hospitals that have the care opinion slideshow. We have people that create boards on wards where they print out feedback and that have care opinion information. People use emails, they use lots of invitation links, they use QR codes. I recently, if you looked on the internet yesterday, I was doing an interview on one of the hospital radio stations. There are so many ways, but it's about finding what works best for the public in your local area. And more we're seeing the use of social media. So not just to promote care opinion, but to celebrate the stories that they're getting in. And we help them with that celebration on Twitter, on Facebook. We're starting to be cool and young now and use the Instagram. I'm not quite ready for TikTok yet. I'm imagining me doing little TikTok dances, but there is a lot. There is a whole variety. And something we're actually starting to do is create peer support groups between the health organisations so they can learn from each other as well. We recognise that the more rural areas are going to be able to support each other, and also the more urban areas, but there is so much that they can learn from each other. So we've already had our first peer support meeting with health boards, and we're going to be doing that with the health and social care partnerships as well soon. But if anyone wants to contact me in Scotland, we've got lots of examples we can give you.
That's beautiful. Thanks for that, Fraser. There's certainly lots of different ways that we can bring people into the platform. I've got another question there from the West in terms of asking. Claire has got a question. Are Scottish Health Services provided with any additional resources in order to be able to deal with care opinion stories? And she's got a double whammy there. And has there been any change in attitudes or approach from health service staff to care opinion since COVID and the increased pressure on health services?
Yeah, so the first one, it's really interesting because we are always encouraging people to recognise that care opinion doesn't just happen. You've got to work on it. And I think early on, maybe naively, they didn't really realise how much you needed to put into it. Just like any system is a system, and it's a system of change. So you need to back that up with staff time. And we see a massive variation in that across Scotland, sometimes based on the size of health boards. With the health and social care partnerships, again, there's a massive variety there. We've even seen one of our partnerships in Perth and Kinross hiring someone full time just to do care opinion. So I think people do have to recognise that. The subscription to care opinion isn't the expensive part. It's the staff time that's the expensive part. But the more people work on care opinion, the more they realise how worth it is. Obviously, and how much cheaper than if they were to do it themselves. So yeah, I don't think people realise that part. But there's certainly a lot now, because we have been around for a long time, where systems have been built up are in place now. Some better than others. But again, through peer support, we're trying to teach each other a lot. And I think one of the most important things are the internal reporting processes. So making sure that it's not just the services themselves who read the story. Who else reads that story? Who else might respond to that story? Who else is it important that sees that story for not just learning and change there, but further out within the hospital and more widely within the board? How are policy areas linked in? So it's just not the team that are dealing with care opinion. There are a variety of teams using care opinion in a lot of different ways. What was the I've forgot the second part of that question.
Me too. Let me just get down.
It was to ask if you've
post-COVID.
seen any change post-COVID with the additional pressure that there are on health service providers in terms of service delivery and workforce challenges. Has there been any change? I mean, it's so wonderful to hear the level of enthusiasm from people about care opinion, but I also do understand that resource issue has intensified a little bit here. I'm imagining it's the same in Scotland. I just wondered if there'd been any change in approach.
Is that a Falkirk accent I hear?
It is.
Oh, wonderful! There we go. Well, interestingly, Falkirk was our latest health and social care partnership that joined us on the care opinion journey. Yes, things did change. So I interestingly started my role 2 weeks into the first lockdown, which was quite fun. But yeah, I think that actually if you look at our numbers from that year in terms of the numbers shared, the numbers actually went down. However, engagement did actually go up, because people recognized that some of the different forms of engagement that they would usually do, that would be face-to-face, they couldn't do, and they couldn't do for a long time. So during COVID, we actually saw a bit of an uptake. We saw more and more of the health and social care partnerships who were considering a full subscription to Care Opinion actually speeding that process up a little bit more. And people were thinking more creatively about how they were doing things. People were using QR codes more. They were using invitation links more, because they couldn't use posters. They couldn't use leaflets. So they had to really rethink how they were doing it. So I think that COVID actually gave Care Opinion a bit of a boost, because people were having to think about how they communicate with people differently. And now that I don't know if you can talk about us being at the end of it, we're in a different world now, but we're seeing more of that integration with online, and people are coming back to, for example, using volunteers to take feedback, but they're linking that back into Care Opinion again, because they will speak to volunteers to say, well, if people need support to tell their story, Care Opinion, rather than just taking that feedback, actually helping them to use Care Opinion.
Thanks, Fraser. That's an awesome cover and response to our questions today, and I really appreciate that. I'm conscious of time and think we should move to our next session, but if we don't get to any of the questions today, please don't be concerned. We will address that through follow-up after the fact. So I'm going to hand back now to Dr. Tina Janamian to introduce our next session.
Well, thank you so much, Alicia, and thank you again, Fraser, for your presentation, the excellent real-life examples that you've shared with us and showing us what is really possible at that larger scale. And it's absolutely mind-blowing to see what can be achieved with perseverance, commitment, and the right resources over time. And the return on investment is really beautiful. It's certainly our vision to see that the platform, the Care Opinion platform, is used more widely across so that all consumers and all families, carers, and health services have the ability to have this relational feedback moving forward. And the Care Opinion team's working really hard with state government, with consumer groups, many leaders across various sectors to ensure that not only across health, but community sector, aged care sector, disability sector, social services, human services, etc., that all consumers navigating the care system have the opportunity to share their resources to support the quality improvement journey, patient safety, workforce morale, and much, much more. So what a wonderful first session we've had, and it's really helped us raise the gaze of what the possibilities are. Thank you again to the outstanding presenters.